for the Healthy Homes and Lead Poisoning Prevention Program. And our program is, if you will, part of or sits in New Hampshire's Division of Public Health Services. And I'm also here today with our Bureau Chief, Michelle Roberge. So just as a quick piece of information, all blood lead level tests that are done in the state, whether it's child or adult, whether unfortunately it's detected very high or there's no lead detected, every single blood test result, as a matter of statute, is reported to our office. So all that information comes into our office, and our clinical team of nurse case managers review those. Another piece of many tasks and responsibility of our program includes putting out an annual lead exposure and testing data brief. And this presentation, I'm going to pull data from both the 2021 and the 2022. We have some preliminary data. I wanted you to be aware of that as well. So just to give you some quick background, as they say, level set everyone on lead exposure and testing in New Hampshire before we take a look at the current data. Oops. I think I went backwards. I'm sorry, going in the wrong direction. Okay, so first, New Hampshire is a universal blood lead level testing state. And by universal, we mean that every child at age 1 and every child, again, a second test at age 2, as a matter of statute, should be tested. And they are usually tested during well child check visits at 12 and 24 months. And the picture you see on the screen with that little girl holding out her finger, then the device on their screen is called a LeadCare2 analyzer. These tests are most frequently done in New Hampshire with a finger stick and a few drops of blood and analyzed on that little device so that providers, pediatricians can share those results with families before they even leave the office. And it's about a $10 test, just so you have that background. In addition to our New Hampshire statute, it is Medicaid federal law, Medicaid federal guidance that all children enrolled in Medicaid health insurance products, if you will, are required to be tested. This is right from the Medicaid website, required at 12 months, and again, a second test at 24 months. And they have specific guidance too on catch-up testing. In addition, any child between 24 and 72 months who doesn't have a record of a blood lead level test, they are required to have one. And Medicaid is very specific that it has to be a blood test. The other piece that I always like to put out in all the presentations that I do is that while there certainly can be more than one source contributing to a child's elevated blood lead level, in New Hampshire, children are almost always poisoned by lead dust generated from old lead paint in their homes. We're going to talk about our housing stock. We have a lot of old housing built before 1978, which was the year we banned putting lead into residential paint. And so it is the housing where most of our children come in contact with lead. And this is national data, just so you have a perspective. This is across the United States, so this is not specific New Hampshire data. But in the United States, 70% of children exposed to lead come in contact with it through housing. 15% of it is through consumer products, sometimes food, and only 15% is drinking water, and that's national data. The other piece is my kind of start by level setting with, somehow there are a lot of urban myths out there that, children have to eat paint chips the size of Doritos and binge eat them to become exposed to lead. We now know that it's really just trace amount of leads like you see on this finger that will result in an elevated blood lead level. It really only takes trace amounts that you will not see on hands, toys, pacifiers, floors, where children sit and play and put things in their mouth. It is trace amounts of dust, dust from old lead paint. In New Hampshire, our housing stock is old and aging. And in New Hampshire, about 55% of our housing stock, like if we take the entire state, was built before 1978. But in many of our communities, especially our high-risk communities, that percentage is much higher than that. Even Manchester, it's 75% pre-1978 housing. Berlin, 89.9% pre-1978 housing. Rochester, Claremont, about 82%. So, we have a lot, children have a very, very high chance in many of our communities to be living in a home, spending time in a home or a rental unit that was built before 1978, and most likely will still have lead paint hazards. So let's just talk briefly about the impacts of the lead exposure on children's development. So what you see on the screen, and I'm going to talk a little bit about this, is an MRI scan from the Cincinnati lead study. The Cincinnati lead study was the longest running longitudinal study in the world, in studying children exposed to lead, not only as young children through adulthood, but also fetuses, babies, if you will, that were exposed to lead in utero, while they were developing in their mothers, and then were born and followed into adulthood. So what you see on the slide is an MRI scan, what's called a composite MRI scan. And it's 157 young adults who were exposed to lead as young children. I think someone may need to mute. So 157 young adults between the ages of 19 and 24. And they were exposed to lead as young children with the average blood lead level of about 13, a little over 13. And they took MRI scans of them as young adults, and as a composite, they lay them all on top of each other so you can see the areas where most of the damage of the brain occurs. And whenever I show this slide, and no matter where I show it, and I'm sure you're feeling the same impact. I mean, especially even in our clinical settings, our physicians, our pediatricians, our nurse practitioners, I mean, people are really stymied by this to really see in the adult brain the damage that, the permanent damage from lead exposure as a young child. So all the areas on the screen that are red, yellow, orange, those are all areas of less gray matter density, less brain. Those are all the areas that are damaged by the lead exposure as young children. And what I often hear, especially from our pediatricians, is, people are really surprised at how pervasive it is, that it's not just one kind of localized area of the brain that was impacted, but it's so many zones are impacted by the lead exposure. Children under the age of 6 do not have a mature blood-brain barrier, doesn't have Mother Nature's fantastic filter fully functioning to keep out lead, mercury, and other heavy metals and toxins. So as a result, that's why our children under 6 are so vulnerable when they get that trace amount of lead dust on their hands and toys and put those into their mouth. That lead moves through their brain unchecked, because their blood-brain barrier is not keeping it out yet. So I'm going to show a short video clip. It's actually of Kim Cecil, Dr. Cecil, who's the lead imaging researcher for the Cincinnati lead study, who gives a little bit more detail on what you're seeing and the long-term impact.
Cincinnati Children's Hospital and the University of Cincinnati have been following children exposed to lead into adulthood. It's the longest running study of its kind in the world.
Nervous? A little bit.
Dr. Kim Cecil is an investigator for the Cincinnati lead study.
So lead tricks the body into thinking it's calcium. Whenever lead has got into your body, primarily through ingestion, It goes and hides where calcium should be, in the bones and in the cells of the brain. Visualize a neuron. There's the neuron that's sending the signal, then another that's receiving the signal. And typically calcium is in that gap.
Calcium is essential for neurons to communicate. But when a child is exposed to lead, lead gets in that gap and blocks the flow of calcium. Without calcium, synapses get weaker and brain function suffers.
The average IQ of the Cincinnati lead study is 86. It should be 100 in a typically developing population.
Lead can disrupt brain growth and even lead to shrinkage or volume loss in brain tissue.
I can give you kind of a hint of volume loss. You can see these ventricles look plump because there's less brain. From this analysis, I can tell you that most of that volume loss is in the frontal lobe, and that region of the brain is responsible for what makes us the most human. It controls our decision-making, our ability to pay attention, our ability to plan, to make judgment, to evaluate rewards, all the things that we need in life to be successful.
Lead can cause harm wherever it ends up in the body. And lead poisoning can even be passed to the next generation.
If you're a pregnant woman exposed to lead when you were a child, that lead is stored in your bones, and when your body needs calcium for the developing fetus, it's pulling lead out of the bone instead of calcium in many cases.
So that is the Cincinnati lead study. No matter how many times I see that video, it always just just what drills in the point when she shows the enlarged ventricles and she says children exposed to lead have less brain. Now they have less brain. And the other piece I always highlight is just she explains that in the Cincinnati lead study, the average IQ is 86. And in a group of children with healthy development meeting milestones not exposed to lead as young children, the average IQ is about 100. I mean, that's 14 IQ points. If you know about IQ, that is pretty astronomical difference or deficit, and is really the difference between functioning well as an adult and not functioning well or independently as an adult. So the long-term impact of childhood lead exposure that's on the screen, these are all research outcomes from the Cincinnati lead study. Again, following children, not only who are exposed to lead as fetuses, but exposed to lead as young children through adulthood. So you understand this, of course, a small amount of lead in early childhood has a large negative lifetime impact, much lower IQ, lower and failing test scores, and low achievement. Obviously, you've seen that MRI scan. You can appreciate children who've been exposed to lead will frequently have learning disabilities, and most, if not all, will need special education services to help support them in extracting an education. Often people associate kind of learning disabilities and cognitive delays with lead exposure, but there's also associated with it very significant behaviors, very challenging behavior challenges for children who've been exposed to lead. Much higher rates of attention deficit disorder and ADHD. This lasts through adulthood. And a piece from the Cincinnati lead study is that children that have been exposed to lead as adults, they engage in at a much higher rate adult criminal activity. You put all of this together, and again, from that tiny little finger full of lead dust, you can appreciate from this list not only the tremendous impact on a child and their family, but you can see from this list the really large economic and taxpayer burden on our schools and our communities as a result of childhood lead exposure. So now I'm just going to talk a little bit about our testing numbers in New Hampshire, starting by showing you kind of the impact, the collateral damage from the pandemic, and then give you some of the preliminary data that we have from 2022 to kind of see where we are moving towards. So during the pandemic, this is just the New York Times headline from about 3 years ago, March 12th. You know that more childhood lead poisoning is a side effect of COVID lockdowns. And really what we saw in New Hampshire and throughout the country was just the testing rates just plummeted because obviously pediatric practices were closed. No one wanted to take, an otherwise healthy child in for a well child check visit during these, especially those early months of the pandemic. So before the pandemic, you can see this graph takes us to 2019. We were on a better trajectory. In large part, we had our initial legislation beginning to address lead exposure in New Hampshire, and low testing rates was signed in July of 2015 by then Governor Hassan. And then in 2018, we had the universal testing legislation was passed, signed by Governor Sununu. And so you could see we were on the right trajectory. We had 58% of our 2-year-olds tested and 70% of our 1-year-olds. So certainly the right trajectory, but no one really writes home about getting a 58 on a test or a 70 on a test. And that 2-year-old test, I should add a little background here, is really important. Childhood lead exposure in the United States peaks between about 18 months and about 26 months of age. And it makes sense when you think about 2-year-olds' behaviors or up to 2 years, crawling, pulling to standing, putting everything in their mouth. So that 2-year-old test is really an important one. That 1-year-old test, though we do find children sadly at 1 year of age with elevated blood lead levels, that is almost a baseline. It is that 2-year-old test that we really want to capture. And we're definitely made progress, but we have a long way to go with those numbers. So pandemic came to our world and we saw a pretty significant drop in our testing rates between 2019 and 2020. And the blue line here is 2018, red line 2019. We were doing even better. Green line, you can see that huge plummet right in April of 2020. In that 1 year from 2019 to 2020, we had a 14% drop in testing rates. An estimated 3,113 fewer children were tested, and we're a pretty small state, just in that 1 year. When we thought it couldn't get worse, it did. I mean, the pandemic obviously was continuing, but there was a recall for a short period of time in 2020 for the testing supplies, the materials, if you will, needed to run tests on that device I showed earlier with just a finger stick. And 75% of our initial testing in New Hampshire is done in office with those devices. So New Hampshire and many, many other states saw their testing rates continue to go down because of the impact of this recall. So in this year of between 2020 and 2021, we had an additional 12% drop in our testing rates with an additional 2,247 fewer children tested. Collectively, over a 2-year span, after we had that wonderful trajectory moving us in the right direction, we had a 25% drop in 2 years with an estimated 5,360 fewer children tested. It's really, really pretty dramatic and disturbing trend in our testing data. So let me take you into 2022. And I, spoiler alert, we are seeing improvement. We still identify areas where we need to put some light, but certainly we are beginning to recover. This is all preliminary data. Our 2022 lead exposure data brief will be released hopefully within the next probably week or weeks, but it's right, what you're seeing right now is from that, but is still considered preliminary data. So the good news is you can see on this graph here that 2019, we were here before the pandemic. We had this pretty significant drop. 2022, we are beginning to see our numbers recover. We have seen our 1-year-old numbers fully recover since and 1 percentage point higher from where we were in 2019, but our 2-year-old testing rates have not yet fully recovered to pre-pandemic levels. And again, they were still at 58% in 2019. So these numbers are still very low. With the increase in testing, we're again seeing an increase in the number of children who've been exposed to lead, who have elevations as identified by their blood lead level tests. Between 2019 and 2022, you can see this graph where it goes down and where it's beginning to come back up. We had 816 children who are identified by a blood lead level test of having an elevation equal to or greater than the CDC's blood lead level reference value of 3.5 micrograms per deciliter. So I want to shine a little bit of light in our children enrolled in Medicaid. These is your children, low-income children enrolled in Medicaid are certainly our highest risk population for 1, not getting tested, and 2, having to be identified as having elevated blood lead levels. In 2022, we had 34% of our children enrolled in Medicaid, these are our 1-year-olds, were not tested. This does represent a slight increase from 2019. In 2019, 40% of our 1-year-olds enrolled in Medicaid were not tested. So that is a slightly better number, but still clearly 34% of our 1-year-olds are not getting tested. Our 2-year-olds, 43% of our 2-year-olds enrolled in Medicaid were not tested in 2022. Again, this does reflect an increase, a positive increase in testing. In 2019, 52% of our 2-year-olds were not tested. So this is definitely progress and good progress. But if 43% of our 2-year-olds enrolled in Medicaid are not getting tested, we really need to be looking at that. The New Hampshire, there have been changes in kind of the incentives that are in place for our Medicaid insurers in New Hampshire. And we believe that's what's beginning to bring us these changes that you're seeing here. So that we're beginning to move this needle since 2019, which is a good thing. So I did want to point this out, and I'm going to drill into this just a little bit. But what you're seeing on your screen is kind of juxtaposed. First, on at least what's the left-hand side of my screen, you see the number of children that are tested. And the gray bar that says 69%. So if we take all the children that were tested in 2022, 69%, that gray bar, were private insurance. They're not enrolled in Medicaid. And the 31%, that smaller blue graph, 31% of all the children that were tested in 2022 were enrolled in Medicaid. On the other side of the graph, though, you can see how disproportionate it is and how high risk children enrolled in Medicaid are. So of all the children tested, only 31% of them were enrolled in Medicaid. But when you look at all the children who had elevations or be poisoned, that had lead in their bodies, 58% of those children are enrolled in Medicaid. So I mean, it just jumps out to you, and it's disproportionate. You can see how disproportionate it is. Very few of the Medicaid children enrolled in Medicaid are being tested, but that's where we're finding this huge number of our elevations. A huge number of the children who are poisoned, who have been exposed to lead, are the children enrolled in Medicaid. So this, I just kind of usually make it a little larger so you can appreciate how disproportionate it is. So what is this data telling us? It's telling us that our testing rates are recovering, which is great news. but we still need to continue to improve those testing numbers. 77% of our 1-year-olds were tested in 2022, and only 57% of our 2-year-olds were tested in 2022. The Medicaid numbers, testing numbers really show us that it's an area that we need to continue to really shine some light on. Because this is our highest risk population. The data shows us not only they're not tested at the rate they should be, but they're also being identified as having elevations higher than those that are not enrolled in Medicaid. And finally, this is a significant pediatric environmental health issue in New Hampshire. We had 4,183 children with elevations greater than the CDC's blood level reference value between 2019 and 2022. So just want to show you, as I begin to wrap up, just a couple of the initiatives, outreach and education initiatives that our program has been sponsoring to address some of the information I've just shared with you. So our New Hampshire Medicaid office and the New Hampshire Medicaid Care Management annual meeting. They have an annual quality improvement meeting once a year, and they choose one topic. And the meeting that's being held in this June, in a few more months, they've identified increasing lead level testing rates for 1- and 2-year-old as this meeting's focus. So that was this is an important. Needless to say, we were thrilled that this was the topic that was identified for this meeting. Our program is also collaborating to sponsor a 6-month QI project, training project for 8 pediatric practice teams throughout the state. And I think many people are familiar with the ECHO project, which is kind of a CME medical training model, but this is also a QI project. So our pediatricians, our practices are submitting data in and around testing into, not to us, but into AAP's system, where we can look at, they're able to look at their data in terms of their testing numbers and what they need to do in their workflow to improve those testing numbers. And this is a collaborative effort between New Hampshire Division of Public Health Services and the Childhood Lead Poisoning Prevention Program, but also AmeriHealth Caritas New Hampshire, one of our Medicaid insurers, and also our New Hampshire chapter, the American Academy of Pediatrics. All 3 are organizing and working together to sponsor this training. This ECHO project started in January, and we were pretty excited about it. We have 8 practice teams throughout the state. You can see them on the map here, and they are federally qualified healthcare centers, they're rural health centers, large hospital affiliates and smaller community hospital affiliates. We have, as I said, 8 practice teams. There are 38 participants, and collectively that 38 includes 15 pediatricians. We also created, it was launched in September of 2022, and this was also a collaborative effort. Our program, the Environmental Health Public Health Tracking Program, along with DES's Choose Safe Places. We created an online training for targeting the childcare workforce, childhood lead poisoning in New Hampshire, how to keep children lead safe. It's an online training that provides the contact hours they need. It's free. Available to everyone, and it launched in September of 2022, and as of the end of February, so just about 18 months, we've had 1,569 people, childcare workforce members, have completed this training. And finally, some of you may be aware of Happy, Healthy, Lead-Free Me, recently released children's board book. We developed that here within our program, along with clinical support from New Hampshire chapter of AAP. And it's a delightful, engaging book for young children, but has messaging on each page for the adult reader, for the parent or family member who's reading the book, to learn about lead exposure, preventing it, and the importance of testing. And this is Christine Arsenault, who's a pediatrician here at Concord Pediatrics and vice president of New Hampshire chapter of AAP, who was not only involved in the clinical review of the book and support of the book, but involved in helping us kind of determine where and how to best hand it out to children. New Hampshire AAP has identified optimizing the 9 to 12 month well child check as the ideal time to get this book out to families before children are getting more mobile and into lead hazards, and introducing the testing that should take place at the 12-month well child check visit. Our program has used some of our CDC grant funding money to purchase these books to be able to provide them at no cost to our pediatricians to hand out to families. And our pediatricians really appreciate it and find it a really valuable clinical adjunct in providing that anticipatory guidance to families.